we are turning it over to the fabulous Susan Goldfarb, who runs our Child Advocacy Center. Thank you, Susan.
Good evening, everybody. My name is Susan Goldfarb, and I'm the director of the Children's Advocacy Center. And the CAC, which is our shorthand for Children's Advocacy Center, works really closely with the District Attorney's Office, and most specifically the Child Protection Unit and other partners, the police, DCF, partners in the community, so that we offer families a safety net, or what we call a team response to support them when they are facing a concern of child abuse. And as Audrey described with the forensic interviews, when a team comes together, our center is actually located on Com Ave in Brighton. And before COVID, a family and a child would walk into the center and come into our playroom. And instead of having to travel from the hospital to the police station, to the DA's office, to another office, we bring all of those professionals into one place. And so before COVID, a family could walk into the center and be greeted by that full team and have the support and services of that whole team. What we have done during COVID is worked really hard, as Audrey described, to recreate that team safely and virtually. So while a child is being interviewed with a TFI or a teleforensic interview, and the rest of the team is listening, we also have one of our mental health clinicians participating in that team so that they can be watching and listening to the child's needs, but also spending time with that child's caregiver to provide them support while they're supporting their child and helping this family move from the possible trauma of child abuse beyond abuse to healing. So we're really proud to be able to say that our services have continued without interruption throughout COVID-19. In addition to the forensic interviews, we're also offering counseling through teleforensic or virtual services in both Spanish and English. We offer those services free of charge. And now that we have opened our center in Brighton partially for the interviews, the partial in-person interviews, we are also able to offer specialized medical services for kids that are provided by a pediatric sexual assault nurse examiner at our center. And so despite the challenges of needing to be separate and the challenges that kids have faced in coming forward, when kids do come forward, we're ready and able to provide them everything that we did before. And I will say that even though the number of referrals has dropped, the number of interviews and the demand for services has not. In fact, I think it's increased because, as Charlene was describing, we're all living in a state of emergency and crisis to some degree. And child abuse, when experienced by a child and family, brings a crisis of its own. And so when you add all this together, families are experiencing enormous stress, what could feel like overwhelming stress. And I guess what I want to convey is that we are here, we're accessible and available. We have resources on our website. We have specific resources for COVID-19 and encourage you to visit our website to be able to look at them. There are activities for kids to support them at home when they're doing their remote learning or outside of their remote learning. There are resources for parents and youth to learn how to be more safe online because kids are spending more and more time online than they ever did before. And with that comes risks that we want to be able to mitigate. And we're also offering guidance on our website for mandated reporters who, despite the lessened amount or diminished in-person contact with kids, are still touching kids, whether it's virtually or in other ways, and we want to make sure they're prepared to recognize abuse and to know how to respond. So the last thing I think I would mention is that people don't often talk about child abuse. We're talking about it tonight, and it feels really important for all of us to pause and sort of recognize that during COVID and outside COVID, kids are experiencing harm, and we as adults in their lives have a responsibility to know how to recognize that and respond to it. So the CAC is also offering and is available to offer training for professionals, for community members, for parents who are interested in learning how to recognize the signs, how to feel more comfortable responding to abuse, and so that they can feel prepared and be ready when a child does come to them and disclose, to know what steps to take to help make them be safer and to help them come to us so that we can envelop them in the team of support that we want to offer to help kids and families heal. Thank you.
Thank you, Susan. And as many of you guys know, with the global pandemic, or many of you know my personal story as the guardian of two of my nieces that both were in DCF custody. When the global pandemic hit, DCF wasn't going into families' homes unless there was an emergency situation. So, you know, what I'm just so proud of with respect to this, the CAC and our child protection unit is, you know, we saw gaps in the system and we responded immediately. So Susan, I appreciate you.